In today's Eye on Health, kids under lockdown due to the coronavirus pandemic. The quarantine is hard enough for adults, but how are children handling it? And how can you tell if your children are okay?
Well, here with some warning signs for kids of all ages is Dr. Gary Swanson. He is a child, adolescent, and adult psychiatrist with Allegheny Health Network. Thank you for joining us, doctor. And, you know, everyone is sort of stressed out because of this lockdown. Are kids more stressed than their parents, or is it just that they respond in a different way?
I think kids definitely respond in a different way. Kids are stressed in their own way, but most of the kids that I've run into don't seem to be as stressed as you might imagine. I think some of it's because they don't have a full understanding of what's going on, and because adults generally are better at worrying about things than kids are.
So is it possible, though, that parents may not recognize their child as overly stressed or anxious?
I think most of the parents that I've been working with recognize when their kids are having a hard time. The routine is different. People aren't able to do their same usual activities. They're not able to go to school, play with their friends, and that sort of thing. And most parents, I think, recognize that that's stressing their kids out. Most parents are trying to find ways to keep their kids entertained and busy and provide them with some structure. Schools have been trying to do that as well, but obviously they're doing all the school stuff online, and that's clearly a different routine. Kids have more free time because the school online doesn't take nearly as much time as a full school day does.
Yeah, you're talking about like obvious signs of stress, but what are some of the ways that a child might act out stress? Like things that parents should watch out for that they might not immediately think, oh, that's because of stress?
So I think you'll see them throwing themselves into preferred activities and avoiding some other things. So maybe more time on video games, more time in their room quietly. And I think it's worth checking in on them and seeing what's going on, what they're thinking about. I think the other thing is that they may actually say that they're more stressed. They may worry about some other things. I've had kids worry about a variety of other things besides COVID in the last few weeks. Sometimes they're worrying about their grades a lot. Sometimes they're worrying about something else that's going on in their lives or in the world. And that may reflect some of the worries that they're having about COVID, but they're not really able to put them into words.
I was going to ask you about that too, Dr. Swanson, because I think that depending on their age, this could be different stress for them. I mean, some older kids who are more aware may worry about older relatives. They actually may even have to care for some of their younger siblings if their parents are essential workers. They're missing their friends and different opportunities. So there are different stressors, right?
Absolutely. And I think for kids of all ages that I've talked to, most of them get the fact that older people, particularly their grandparents, might be at a higher risk. And most of the kids that I talk to have expressed not worries about themselves getting an illness, but more worries about grandparents getting an illness. And it's really important for parents to convey to these kids that they're not worried, that they feel that they will keep them safe and that the kids are safe. Kids need to understand and get that message from their parents. But it's harder to give that when about a grandparent, for example, who is older, who might have some physical problems and might be at a higher risk.
And so much of it, I would assume, is what you put out. If you're sending a stressed sort of energy out, your kids pick up on that. What can parents do? Like, what sort of conversation should they be having with their kids right now?
So first, they need to sort of look at their own emotional response and make sure that they're conveying some calmness, some patience, some tolerance, some understanding. I think second, to try and keep the kids informed, answer questions the kids might have at the kids' level. Kids are going to have a variety of questions, and you want to answer the questions clearly, but at the level that the kid is asking, and don't give them too much information. The last thing we can do is sort of tell them what we can do. You know, we're wearing masks, we're washing our hands. These are things that we can do to help make sure that the coronavirus isn't spread. We're not visiting live and in person or touching people, but we can communicate through FaceTime, through video chats, through the phone, through email, so that people know that their loved ones are safe and are maintaining that kind of connection. It's hard being away. It is really not about social distancing as it is about physical distancing. We still want kids to maintain their social contacts with their friends, with their family, with all their relatives.
And you mentioned, doctor, about some of the signs, withdrawing, those sorts of things, maybe ignoring some other things that they may have to do in the house. But under what circumstances do you think it's extreme enough that you need to contact a professional?
You know, I think any time that a child is exhibiting significant distress, crying a lot, seemingly really, really upset by things, or when they're not able to do the things that they really need to be able to doing, if they're not able to keep up with their schoolwork, not just for a day or two, but for a longer period of time, if they're not eating, if they're not sleeping well, those may be times where you're going to be calling and touching base with somebody. I mentioned sort of sleep. Kids will, when they're a little more anxious, they'll have a hard time sleeping. Maybe you need to look at the routine and see what you can do to help them out with that for a little bit. Younger kids in particular, night lights, maybe you change the sleeping arrangements a little bit, knowing that they're feeling a little more anxious and unsafe. But again, if parents can convey an attitude of, we've got this, it's going to be safe, there are people that are taking care of you, there are good healthcare professionals that are out there, and we're working to defeat this problem, I think kids feel reassured in that way.
Thank you so much, Dr. Swanson. You've been a big help this morning for us.
Thanks. Glad to be on. Thanks for inviting me.
Great advice. Thank you, doctor. Well, remember to keep watching our Eye on Health series right here on PTL. Happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.